Good day, folks. Thank you for joining us here at Your Health. On today's program, we want to talk about something we don't talk very much about, urinary tract health. Are you one of those who have one bladder or kidney infection after another? Are you looking for a way out of this? Boy, that condition can make you feel sick, and it's painful too. It's not good. It's a bad thing to have, and we want to break the cycle. Well, on today's program, we're going to talk about cranberry juice and D-Mannose, two substances that help to prevent urinary tract infections, and they really do work. We'll go through the science on these two compounds today, substances, juice and mannose, and you decide for yourself. See what the scientists say, make your own decision, but I think you're going to see they make a difference. That's our concept for today, urinary tract health. First, let's go to our news. Let's see what's happening in the health world. Eating healthy on a budget is within reach. Researchers from the University of California, Davis found with menu planning and buying in bulk, it is possible to feed a family of 4 healthy meals at a cost of about $30 a day. The $30 a day meal plan met USDA dietary guidelines. However, it did require ready access to bulk supply and a general supermarket. The economical healthy eating plan allowed for dietary variety and cultural food choices. The study was published by the Journal of Nutrition, Education, and Behavior. Related research shows the health benefits of eating an improved diet begins almost immediately. Researchers from St. Louis University found the study subjects that ate a Mediterranean diet showed a 6% improvement in exercise endurance after just 4 days. This study was published by the Journal of the American College of Nutrition. One of the common reasons why many people choose to eat poor quality foods is they think it's cheaper to eat processed and fast foods than buying and preparing healthy foods. Now, our first study finds this assumption is not necessarily so. This study found you could feed a family of 4 at a cost of about $30 a day. The meal plan met the USDA My Plate guidelines, and it allowed for variety and even cultural food choices. See, no one likes dietary boredom. We need nutritional variety. It's a foundational hallmark of a healthy diet. So it's good to know you can have a varied diet complete with cultural influences and still stay on your budget. They did, however, find you will need to do some planning ahead. You will need to spend more time in shopping and preparing your meals, and you will need access to bulk foods and a general supermarket. Now, these prerequisites are actually met by at least 85% of all Americans, so it's doable for most of us. And finally, we learn when we commit to a healthy diet, such as is afforded by the Mediterranean style of eating, we will receive demonstrable benefits within days. Our second study found athletes improved their exercise endurance by 6% within just 4 days of eating healthy. Sleeping in on the weekend will not repay your sleep debt. Researchers from the University of Colorado wanted to know if the common practice of staying up late during weeknights, then sleeping in on the weekends, made up for lost sleep. They evaluated sleep and health parameters of 36 subjects. They found the subjects that followed the pattern of sleep deprivation during the week, followed by catch-up sleep on the weekends, showed declining health parameters. This group snacked more, and they showed a decrease in insulin sensitivities. Both patterns, if continued over time, lead to an increased risk of weight gain, obesity, diabetes, and cardiovascular disease. The study was published by Current Biology. Related research from the University of Warwick finds new parents face 6 years of disturbed sleep after the birth of their first child. Mothers lost 1 hour of sleep a night, while fathers lost 15 minutes. The sleep-depriving effect of having a child decreases with each subsequent child born. This study was published by the journal Sleep. And finally, from scientific reports, we learned exposing morning-time sleepyheads to blue-enriched light helps them to wake up more efficiently. The researchers found exposure to early morning blue light helps to lower melatonin levels, thus promoting wakefulness. You know, I think everyone watching today has experienced a week of poor sleep, followed by a weekend of trying to catch up on that lost sleep. But does it work? Well, this study found it does, but if you go right back to missing sleep during the work week, you will end up eventually with weight gain, insulin resistance, and an unnecessarily high risk of diabetes and cardiovascular disease. Bottom line on this issue, slow and steady wins the race. Now, we all have sleep-deprived weeks, but we can't make a long-term practice of it. The next study is no surprise to experienced parents. When you accept the responsibility of raising children, you're going to lose some sleep. Fortunately, with time and more children, the effect wears off. Our final study focuses on a positive effect of blue light. In the past, we've discussed the effects of late-night blue light-emitting electronic devices and how they lower melatonin levels, making it difficult to fall asleep. This study finds if you're having trouble wakening in the morning, even after a good night's sleep, try exposing yourself to 1 hour of blue light. The practice will lower melatonin and other sleep-inducing hormones, allowing for a bright and cheerful morning. Well, today on Your Health, we will discuss Cranberry and D-Mannose for urinary tract health. Please stay tuned to learn more.
Do you believe that nature holds the answer to your health needs? Are you looking for a supplement that's simple and pure, yet really works?
If you're looking for nature's answer to better health, look to Aloha Noni Juice. It's pure and fresh, just like nature intended. Aloha Noni Juice is brought to you direct from the islands of Polynesia.
Aloha Noni Juice is 100% pure with no added sugar or sweet fruit fillers. It's the perfect addition to your low-sugar diet.
Aloha Noni Juice drinkers will tell you their vitality, energy, and sense of well-being have improved, along with relief from many painful conditions. Made by nature, proven by science, Aloha Noni Juice contains only nature's best.
And now you can enjoy the benefits of our new 100% certified organic Noni Juice.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. I'm Cindy Becker for Your Health at a Glance. Do you remember the questions you wanted to ask your doctor after you've left the doctor's office? That's happened to me, so here's my strategy to get ready for a doctor visit. If it's a first-time appointment, be sure your medical records arrive ahead of you. The doctor can review your history quickly. This leaves more time for discussion. For every visit, write down your questions at home. Include a list of medications you take. When you arrive, fill out the medical history forms concisely and accurately. Attach a copy of your questions with the forms so the doctor is aware of your questions before he or she steps into the exam room. Bring your friend for support and have a notepad to take notes. Before you leave, have all your prescriptions. And here's hoping you don't go to the doctor very often. With Your Health at a Glance, I'm Cindy Becker.
There are thousands of fungal species, and at least 200 of them have been found to cause human diseases.
Fungal infections are common, so what can we do to protect ourselves?
One solution is oregano, a natural alternative. Oregano fights problems created by fungus and yeast overgrowth, and it improves many other health conditions.
At BioInnovations, we offer oregano in gel caps and liquid extract.
Yeast and fungal disorders can improve.
So take charge of your health by choosing a natural alternative such as oregano gel caps or oil of oregano liquid extract.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
Welcome back, everyone. It's great to be with you today. We have an awesome show planned for you. We're going to be talking about the health benefits of cranberry extract and adding D-Mannose to it for urinary tract health. This one is so important. If you suffer from chronic UTIs, bladder issues, you know what I mean. It's miserable. And you know what? The health world does have help. Richard, this one is so important for everyone. And you know, if someone suffers from this particular problem, it's over-encompassing, and it makes them very ill. And there's help that we can give them.
You know, thinking back to our family practice years, those patients who were suffering from a bladder or kidney infection, a urinary tract infection, they suffered greatly. And the poor souls who had one infection after another. This is who our audience is today. We're trying to break that cycle of one bladder, one kidney infection after another. It's really a bad thing, and we need to take steps to help this. Enter the North American cranberry. You know, cranberry is more than just Thanksgiving fare. I love cranberries. I do. I like them dried. I like them in the can. I like them fresh. You name it. Cranberries are delicious. The scientists call cranberry Vaccinium macrocarpon, and this is a dwarf evergreen shrub with tailing vines, and it grows naturally in marshy wetlands in North America and primarily. It's now extensively cultivated in North America, and the fields are flooded to aid in the harvest. And we've all seen images of the farmers and the agricultural workers out there with their hip boots on and rakes pulling in the brightly colored cranberries with the flooded field. And I've always wondered, how does all this work? And preparing for this program, I learned that it is a major operation preparing fields. It's a big investment for the cranberry farmer to create fields that can be flooded, and then going through this process, and they have completely specialized equipment that can't be used anywhere else. So they put a lot into this. And cranberries, of course, are much more popular in North America because in our Pilgrim heritage, remember this story of turkeys on Thanksgiving Day brought to them by the Native Americans, helped save their very existence. They learned from the Native Americans that cranberries were a good source of nutrition through the tough winter months, and it was used that way. So 98% of all cranberries are produced right here in North America and the United States in particular, and Canada. It's really a fascinating thing, 98%. And so there's some 700,000 tons produced every year. Historically, cranberries were used by Native Americans as both a food and as a medicine. The first recorded use was in 1683. All the way back, 1683. And of course, it was used for many, many centuries before that by the Native Americans. The putative use, or use through reputation as a food, the Native Americans used it to treat urinary tract infections. They taught us this practice. It's been hundreds of years of use of cranberry to help treat urinary tract infections, and primarily to prevent them. Wound care, blood poisoning, and the leaves were also used to treat diabetes and diarrhea. So not only is the cranberry nice food for the holidays, brightly colored and adds a lot of festivity to the occasion and a beautiful table, but they have medicinal value as well. Now, the vast majority of routine daily use of cranberry is in cranberry juice cocktail. As you know, fresh natural cranberries are very, very tart. They're very acidic. They have a low pH, and most people add a lot of sugar to them. And in the form of the cranberry juice cocktail is really only about 25% real cranberry juice. The rest is sweet fruit juices like apple juice, pear juice. And so this adds a lot of sugar to our healthy cranberries, which is a problem because sugar inhibits the immune system. And if we're taking high sugared cranberry juice cocktail to help prevent our bladder infections, we're inhibiting our immune system, and there's got to be a better way. We need to find ways to lower our sugar intake, not take more. So I want to give you this fact. Cranberry juice cocktail has about 36 grams of sugar per cup, per 8 ounces. 36 grams. That's about 10 teaspoons of sugar. A little more, 11. That's as sweet as soda pop. Fresh cranberry juice, without the added fruit juices, has about 19 grams per 8 ounces. So the natural fresh cranberry is about half as sugared as the juice cocktail. And of course, when people try to drink pure cranberry juice, it's so tart, they have trouble continuing that practice. The studies have shown this. Low compliance with natural fresh cranberry juice. That is why we desiccated the juice, took the water out, and put it in a capsule. So you don't have to deal with any of those issues. You don't have to put sugar in a capsule to take that, do you? No, I just wanted to make that point. The vast majority of cranberries consumed in America today is in the cranberry juice cocktail. And I don't want to disparage anybody's product, but this is a health program. We're trying to reduce our sugar intake, not increase it. Let's talk about the scientific research on the cranberry. The cranberry is full of bioactive compounds. The bright color of the cranberry, what color would you call the cranberry? I guess it's cranberry. They call it cranberry, don't they? That's how they identify the color. This color comes from the proanthocyanidins, anthocyanidins, flavonols, and phenolic acids, and polyphenols. If you've watched this program very often or for very long, you've heard us talk about antioxidants and polyphenols and the anthocyanins and this type of compounds. They are health promoting and they have a bitter taste to them. And cranberries have a bitter taste. That is an indication of how healthy it is, actually. The cranberry contains a variety of compounds called fruit acids. This is things like citric acid. Citric acid is one of the healthiest fruit acids you can consume. It helps to prevent kidney stones. It helps to correct urinary tract pH, which is very important. It is used to treat gout, to prevent the kidney stones, as we mentioned, citric acid, but there's quinic acid, malic acid. These are fruit acids, and this is why cranberry juice has a pH of about 2.4. That's a fairly strong acid. So when we're drinking fresh, natural cranberry juice, it's quite tart, it's quite acidic, and many people find that difficult to continue day after day after day. I want to make that point. That is why, because we make a point of get as close to nature as possible in our diet. Don't process your foods. Whenever possible, get it as close to nature. But in this case, you will be able to continue on with your program of urinary health improvement if you take a capsule version. Does that make sense? Good. Now, cranberry also contains a very unique compound that is not found in virtually any other food. This is what they call A-type proanthocyanidin. And it is one of the few foods found in nature with this unique antioxidant. And this proanthocyanin, type A it's called, is what gives cranberry its unique urinary tract benefits. Type A proanthocyanin. Now, urinary tract infections is the #1 urologic condition. #1, it's not kidney stones, it's not kidney cancer, it is urinary tract infection. It keeps urologists very busy. It costs this country some $4 billion a year. It can occur in young, healthy people. It can occur in elderly people. It can occur in people with underlying disease. It can occur in people with no underlying disease. It can occur in normal anatomy and in people with altered anatomy. Unfortunately for the ladies, urinary tract infections are much more common in women. 50 to 1. 50 women will have a UTI to 1 case of a man. Isn't that unfortunate? But it's due to anatomical differences. This is how God made us. We have to deal with this difference. Now, if a male has a urinary tract infection, from cradle to grave, it should be evaluated. If a woman gets a urinary tract infection, most of the time, you can give an antibiotic and things will be fine. Maybe you get a urine analysis and a culture, that's a good idea, but you don't need studies to assess the anatomy. But if a man has that, you really should, or a child or a boy. Now, let's go to our break, and when we return, let's talk about the science of how cranberry helps prevent these terrible urinary tract infections. We'll be right back.
For centuries, the herb astragalus has been a staple of traditional Chinese medicine. It's used to create a strong shield, protecting the immune system.
Astragalus is also used to support healthy heart and lung function.
There's even more. Astragalus helps to calm total body inflammation, a common cause of pain and chronic illness.
All of that without the use of medication.
That's right. Support your health the way nature intended with astragalus root.
BioInnovations brings you Dr. Becker's Bionutrients Astragalus Root Extract. BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128 or order online at bioinnovations.net and see what astragalus can do for your health. That number once again is 888-442-2128. Ask about the AutoShip program for additional savings. Call today.
I'm Dr. Richard Becker for Your Health at a Glance. Do you have a family history of a certain disease? Scientists are discovering that our genetic code plays a smaller role than previously believed. Only about 20% of disease is tied to our innate genetic code. So what determines the other 80%? The answer may lie in the emerging field of epigenetics. What is it? Epigenetics is a group of changing factors responsible for both how our genes are read and how they are then applied throughout the rest of the body. And this may explain why identical twins with identical genes can have different health problems. Researchers believe two of the main factors in epigenetics are nutrition and environmental exposure to toxins. So eat a healthy diet, reduce toxin exposure, and you may improve your own epigenetics. For Your Health at a Glance, I'm Dr. Richard Becker. Different people have different vitamin and mineral needs. That's why Dr. Becker's Bionutrients Multiple Vitamin and Mineral Powders come in 4 different blends.
That's right. When it comes to vitamins, no one formula is right for everyone. For those who don't get enough vegetables in their diet, there's the Organic Green Blend with 3 servings of vegetables in every tablespoon.
And for those looking for a boost of fruit and berry phytonutrients, there's the Berry Blend with 3 servings of fruit in every tablespoon.
And don't forget the Active Adult Blend with extra B vitamins, calcium, and added cofactors like ginkgo and CoQ10.
Plus, we've designed a multiple for those with allergies called the Low Allergy Rice Blend.
Whatever your unique needs are, BioNutrients has a multiple vitamin that's just right for you. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
We're back, everyone, discussing cranberry extract and D-Mannose today. We're going to learn how these amazing nutrients can really help you manage UTIs and bladder health. Richard, it's often been said, and a lot of people do go looking for a cranberry extract when they do suffer from an UTI, and we're all told that the cranberry extract will help prevent the bacteria from adhering to the bladder wall or the urinary tract lining. How in the world could that be possible?
Well, that's a good question. It actually think of it as making the bladder wall slippery, so to speak, so the bacteria cannot adhere to the bladder wall. And once it adheres, if it does adhere, it invades into the bladder wall, and then you have a deep-seated infection and very painful. Cranberry helps to prevent that. This also leads to a very important point. If you are deep in the throes of an active urinary tract infection, cranberry or D-Mannose will not help you much. If the bacteria have already invaded deep into the wall, preventing the next generation from adhering isn't going to make much difference. This is very important. Where this combination, cranberry and D-Mannose, plays a role is in the prevention. We get the current infection cleared, and then we help to prevent the next one, which is the major problem. So we are addressing recurrent urinary tract infections. If you have an infection, you will most probably need an antibiotic. I'm not telling you not to do that. Get the help you need, because before the era of antibiotics, we had what was known as Bright's disease. This was chronic pyelonephritis, chronic infection of the kidney. And this killed people, scarred the kidneys, led to long-term suffering. I don't want anything to do with that. Using an antibiotic to treat urinary tract infection is a proper and justified use of a medicine. Absolutely. But once you get that cleared, let's get you on a plan to prevent the next one. So many ladies, particularly ladies, have one after another after another. This is what we're trying to prevent. The cranberry's type A proanthocyanidin is the compound that prevents the bacteria from adhering to the bladder and the entire urinary tract lining wall. It helps to prevent it. If it can't attach, it can't seed the infection. Does that make sense? Because I want you to understand this important point. But there are also gastrointestinal benefits to cranberry. This same A-type proanthocyanidin prevents pathogens in the intestinal tract from attaching. Pathogens like Salmonella, pathogens like H. pylori, which is known to cause stomach ulcers. They've been able to show, scientists, thank goodness for them. They explain so much. Well, if cranberry prevents infections in the bladder, could it maybe prevent infections elsewhere? And yes, it helps to prevent infections in the gastrointestinal tract as well. But there's more to cranberry than just this A-type proanthocyanidins. These fruit acids that we discussed, malic acid, quinic acid, shikimic acid, citric acid, these are fairly strong acids for a food. They inhibit bacteria. That strong acidity inhibits bacteria in the urinary tract, reducing their numbers. So there are fewer bacteria to attach to the wall. Okay, so that helps. It improves the urine pH and overall resistance to infection. Manipulating urine pH is a major part of this, and the fruit acids do that for us. Cranberry also contains oligosaccharides. What is that? Oligo means a few. Saccharides are carbohydrates. So it's a few carbohydrates in a chain, short chain carbohydrates. These short chain carbohydrates inhibit bacterial binding to urinary and gastrointestinal tract as well. So we have three agents that inhibit binding or inhibit bacterial growth: the oligosaccharides, the fruit acids, and the type A proanthocyanidins. This is a synergistic effect. If we're just counting on one, it's not so good. But when we get all three together, that's teamwork. That's how you get something done. We also have these beautiful antioxidants. You look at the cranberry. I think God made fruits and berries and cranberries, this type of thing, with those bright colors to attract us and say, I have something special for you. This is just my own opinion. But it kind of works for me when I think of it that way. Pay attention to this food. It's beautiful, it's pretty, it smells nice, it will make you feel good. Because they don't necessarily taste good. Bite down on a fresh cranberry, woo, it's tart, but they're very good for you. Antioxidants, those color pigments are antioxidants. Proanthocyanidins, anthocyanidins, flavonols, phenolic acids, vitamin C, they help with the free radicals. Helps prevent cardiovascular disease, and anti-aging, and even anti-cancer effect. These molecules calm inflammation. This is one of the new uses of cranberry, is to help calm inflammation, reducing pain and swelling, along with the risk of cardiovascular disease, cancer, and diabetes. One of the major features of reasons why you'd want to use cranberry during an acute UTI is it calms the inflammation, the pain, and swelling of the infection. Don't think of it so much as, this is my antibiotic. It's the only thing I need for a UTI. Think of it as it'll help calm the infection while my medicines are going to work. So there is a place for cranberry during the acute infection. It's not just in prevention. You can use it both ways. Does that make sense? I want to be very clear about this. Okay, but for our lack of knowledge shall we perish. We must have better understanding of these health issues. We can't count on doctors to do all this for us. When you go to the doctor, how much time do you spend with them? 2 minutes, 3, 4, 5? You're lucky if you get 8 or 10. When was the last time they explained any of these things to you like this? Well, they just don't have time for that. It's up to us to learn these things. Let's keep moving. Blood lipid improvement. These antioxidant, brightly colored pigments, they help to improve your blood fats, the cholesterol, the triglyceride, blood vessel and endothelial function benefits. These antioxidants help to improve the health of the artery, the control of the artery, the blood flow is improved, the brain center of the artery function is improved. We call that endothelial function. Endothelia is the lining, the inner lining of the artery, and it's the brain center that controls, so to speak, the artery. We improve that function with these antioxidants. Intestinal microbiota improvement. This is a new area in research on cranberry, is when we take cranberry longer term, It improves the microbes, the probiotics, as it were, of the intestinal tract. Who knew that happened? Well, this is what happens with a healthy diet. When you use a diverse and consume a diverse and healthy diet with fruits and vegetables, you get all of these tremendous benefits. Now, when we return from this break, we're going to talk about the overwhelming scientific evidence that cranberry helps to prevent urinary tract infections. There has only been one piece of information, one research review. It's not even new research that cast dispersions on cranberry. And it changed everybody's attitude for the worse. And it's not fair, and we want to talk about that when we return.
Are you one of the 62 million Americans suffering from gastrointestinal problems? Do you struggle with other chronic conditions? That's why we offer Dr. Becker's Bionutrient Probiotics.
After years of research, we developed a revolutionary probiotic formula with gastrodefense technology. This system protects the good bacteria from stomach acid so the probiotics reach the intestines where they go to work. Additionally, we use live count technology to prolong the shelf life of the probiotics, so there's no need for refrigeration.
Dr. Becker's Bionutrient Probiotics is a powerful combination and one of the most effective formulas available today. And we offer a children's chewable formula too, both at prices you can afford. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
I'm Dr. Richard Becker for Your Health at a Glance. Are you tired all the time? Persistent fatigue along with shortness of breath, headaches, and unusual food cravings may all be a sign of anemia. Anyone may develop anemia, but toddlers, women in their reproductive years, and the elderly are most likely to become anemic. If you are diagnosed with anemia, it's important to understand why. Even mild anemia, untreated, can lead to serious illness. Your doctor will diagnose the type of anemia you have, how you develop the condition, and how to treat it. There are many forms. But not all types of anemia are treated with iron. In fact, taking extra iron when it is not needed may add to your health problems. Once you finish treatment, you must follow up with your physician. Anemia can recur. For Your Health at a Glance, I'm Dr. Richard Becker. Have you heard of Cordyceps sinensis, the medicinal mushroom that supports metabolic processes for stimulant-free energy? This remarkable mushroom also supports the immune and respiratory systems, as well as the heart and lungs.
Bioinnovations brings you Dr. Becker's Bionutrients, Cordyceps sinensis.
Medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems. And Cordyceps sinensis is among the safest and most powerful medicinal mushrooms available today, making it your choice for stimulant-free natural energy.
Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. Give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Be sure to ask about the AutoShip program for additional savings.
Welcome back, everyone. We're talking about cranberry extract and D-Mannose for urinary tract health. This is so important and so amazing. So to help you get this today, we have a newly formulated, we've taken the cranberry extract you already know works, you already love, and we've added D-Mannose to it. This new product is buy one, get one free today. That's where you buy one bottle at the regular price. You get a second bottle free. This one is fantastic. Richard, you have some research now on cranberry.
Let's start with the beginning. In the 1990s, scientists in earnest wanted to know about the effect of cranberry. Give you an example, 153 nursing home patients. Nursing home patients are very susceptible to urinary tract infections, very susceptible. When they took cranberry, 50% reduction in urinary tract infections. That study was repeated multiple times in the 90s. In the 2000s, multiple studies using cranberry juice or cranberry powder showed similar results. 50% reduction. Every single study shows a reduction so far. They all show reductions in recurrent urinary tract infections, reinfections. In 2010s, double-blind, placebo-controlled, these are high-quality studies, 373 adult female patients. Let's see, 98% compliance. People were able to take it. 40% reduction in UTI in the interventional group. This was the largest trial ever done, and it was positive. 40% reduction in recurrent urinary tract infections. In the 2010s, 3 pediatric trials in children with recurrent urinary tract infections. One study, 40% reduction. Second study, 65% reduction. Third study, 43% reduction in recurrent UTIs. Folks, the standard of care is taking an antibiotic every day for months to years. You know what happens? Within a year, 80% have resistance organisms growing, and the antibiotic no longer works. Plus, they have dysbiosis and all sorts of things follow. We need alternatives. Next, 2014, 176 active women, double-blind, placebo-controlled. This one used Pacran powder, which is a cranberry powder. In fact, it's the exact same one we're giving to you in Cindy's product. Packer, same stuff. So our product we're going to provide for you is research substantiated. I love that. I love that. So in this study, 26%, those who took Pacran, only 11% developed a reinfection. UTI placebo, 26. So it's, if you did nothing, you're if you took the cranberry powder, you're 60% less likely to have a recurrent urinary tract infection. Czech Republic, 64 men with prostate cancer. Prostate cancer patients are susceptible to urinary tract infections due to the cancer. Well, they found it lowered their PSA by 23%. That's helpful for the cancer patient. They weren't looking at urinary tract infections, but I would suspect it would help with that too. It helps women. Why wouldn't it help men? A meta-analysis. Now, this is where we get to the controversy. Meta-analysis is where you take the established research and you put it all together so you have a more powerful study with many more subjects and see what that says. In 2008, the Cochrane Review Association, where they're famous for reviewing research, they reviewed all of the available research on cranberry and UTI, and they said, this stuff works. This is 2008. 13 other groups reviewed all the evidence. 13 independent peer-reviewed groups reviewed all the evidence on cranberry and recurrent UTI. They all agreed that cranberry helps to prevent the next urinary tract infection. 28 more trials came, not reviews, but trials. They all showed significant reduction. And then in 2012, Cochrane decides to do it again. And they took all of this information and they jumbled it up, and guess what they concluded? No, cranberry doesn't work at all. It's the only negative study to date. And there was no new study done, no new information. They just shuffled the deck. Now, critics of that result say this was not a good study because they were actually comparing apples to oranges. The heterogeneity was off, wasn't good. Apples to oranges. Think of it, they weren't making proper comparisons. They had low compliance due to bitter taste. If you're drinking the fresh juice, you're probably not going to keep it up. Taking the capsule with the extract is much better. You'll keep that up. And high withdrawal rate, inconsistent dosing, lack of standardized juice. You know, we talk a lot about how important it is to standardize things. And that affected the second Cochrane review. It's the only review. It's the only study that shows anything. But what does everybody cite? Oh, that doesn't work. Cranberry doesn't work. Not so. Please. You know, I have observed, and this is purely my opinion, the powers that be want you dependent on the system. I don't want to be dependent on the system. I want to think for myself as much as I can. And if my way is not working, I'll go to an expert and get the help I need. But with my increased knowledge, I know who really is an expert. See, it's win-win when you know more about your health. So all of that controversy, please ignore it. It's invalid. Cranberry helps to prevent recurrent UTI. I can absolutely promise you, that your risk will be reduced. Now, I want to be clear, people can take cranberry and still get an infection. It happens. And towards the end of the program, we'll give you a list of complementary things you can do to make your cranberry and your D-Mannose even more effective. But I promise you, it is legitimate. It makes a difference, but it should not be used to treat an acute infection. You can use it as a complement to your antibiotic or your other measures, but the real role of cranberry is to help prevent the next infection. Okay? Now, when we return, let's talk about the second component of this great combination, D-Mannose. What is that? Well, it's simply a carbohydrate that helps prevent bacteria from sticking to the wall as well. We'll be back with that. Every day, about 200 million Americans do not get enough of a key essential mineral.
That mineral is magnesium. The typical American diet does not supply enough.
And magnesium is so important. It protects bones and helps more than 300 different enzymes in the human body perform efficiently.
That's why Bioinnovations offers chelated magnesium capsules for oral use and topical magnesium gel to be applied to the skin. That's 2 forms of magnesium to meet your daily needs.
Scientific evidence points to chelation as the best method of vitamin and mineral formulation.
Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health.
Because chances are you are one of the 200 million Americans who need more magnesium every day.
Again, that number is 888-442-2128. Call today. Ask about the AutoShip program for additional savings.
It's been said that life is not measured by the number of breaths we take, but by the moments that take our breath away. Jesus, while discussing his role as the Good Shepherd, phrased it like this in the Gospel of John: I have come that they may have life and have it to the full. That comes from John 10:10. We can enjoy an abundant life through Christ, a life like that described by President Abraham Lincoln, who said in the end, it's not the years in your life that count, it's the life in your years.
Vitamin D deficiency is at epidemic levels in the United States. Chances are you aren't getting enough of this essential nutrient. Vitamin D is one of the most important molecules in the human body. It's required for the proper function of nearly 4,000 genes and 1,000 metabolic chemical reactions.
Bioinnovations brings you Dr. Becker's Bionutrients Vitamin D3. Now, supplementing with vitamin D is safe and affordable.
Studies show that vitamin D deficiency can lead to poor immune function, depression, cardiovascular disease, bone disease, diabetes, cancer, and much more. Starting supplementing vitamin D today for better health tomorrow.
Bioinnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net.
We're back, everyone, talking about cranberry extract and D-Mannose. And to help you get this, I want to remind you about the special today. We have the cranberry extract by Dr. Becker's Bionutrients that we've added D-Mannose to. Fantastic product that really works. Buy one, get one free today only. So, Richard, now let's turn the tide a little bit and start talking about D-Mannose and how amazing this one is.
Yes, it truly is. D-Mannose is a simple carbohydrate or sugar molecule that complements cranberry's ability to help prevent urinary tract infection. D-Mannose is a non-essential nutrient. We don't have to have it. We can make it for ourselves, but when we consume D-Mannose, it can be converted to glucose, but our body would rather use mannose to make what's called glycoproteins. Mannose attaches to a protein, and it's incorporated into various structures in our body. This is normal, it's natural, it happens without us ever thinking about it. Now in the urinary tract, this D-Mannose attaches to the protein in the urinary tract, and that glycoprotein, glyco is the mannose protein, that combination is the little stump, the little attachment, the docking station that the bacteria attaches to. Okay? If we take D-Mannose and we have free mannose in our urinary tract in the urine, it occupies the attachment spot on the bacteria so it can't dock. Make sense? So it gets swept out with the urine flow, avoiding attachment and invasion into the tissues and preventing infection. So ingesting D-Mannose, it helps to prevent the bacteria from attaching to the bladder wall, but from a different mechanism than Cranberry, making it even more effective. D-Mannose and Urinary Tract Health Research, European Review for Medical and Pharmacological Science. D-Mannose, if you take it to prevent a urinary tract infection, it is 86% more effective than doing nothing. You're much less likely to get an infection if you do D-Mannose. This is just D-Mannose alone, just alone. It's better than hoping you don't get sick again, much better. Neurology and neurodynamics, multiple sclerosis patients have damaged nerves, and they have great trouble urinating. They often have to use a catheter to relieve themselves. And anytime we do that over and over, you're introducing bacteria, and they're very susceptible to infection. Well, we don't want that to happen. It makes them very sick. They found if the multiple sclerosis patient took D-Mannose, it reduced their UTI rate significantly. It benefited them. Large study, double-blind, 308 women with recurrent UTIs. D-Mannose had a 15% reoccurrence of infection, 20% reoccurrence of infection if you took the standard of care daily antibiotic for a month. D-Mannose worked better than the daily antibiotic. Worked better, and yet the daily antibiotic is the standard of care. Why? Why is that so? Well, I'll tell you why. There's no drug company behind D-Mannose. It's just that simple. British Medical Journal, review of non-antibiotic options for the prevention of recurrent UTI. This is where doctors go to learn how to treat disease. Keep you current. British Medical Journal, review of all the non-antibiotic ways to help prevent UTI. D-Mannose is a viable option for the prevention of UTI. This is according to the peer-reviewed British Medical Journal. It's accepted now. You can do it. It's okay. British Medical Journal, open access. Long-term antibiotic therapy for recurrent UTI reduces UTI by about 79%. It works. Mannose reduces it by 85%. Mannose works better than the antibiotic. However, those who took the antibiotic in this study, 70% of them developed resistance at the end of 1 year and no longer works. But D-Mannose keeps working, and none of the side effects that long-term antibiotics lead to. This is good news. This is good news. Antimicrobial Original Online Research 2017, D-Mannose with cranberries, this is combining it. Type A proanthocyanins are effective both during acute treatment and in the prevention. Now we have research shows that UTI, you're in the middle, you're in the throes of the infection. If you combine the D-Mannose with cranberry, it works. It works for the acute infection. Is it enough? Well, that depends. There's a lot of factors at play. You'll need your help of your doctor with that, but certainly we can start the Cranberry and D-Mannose to help prevent the next one, and that's the point of all this. Now, real quickly, non-antibiotic ways to lessen your risk of infection, urinary tract infection. Of course, we've been talking about Cranberry and D-Mannose. That's, of course, on the table. More water, less coffee, tea, and soda. This one's very important. More water. Improve your hygiene. Showers, no baths. Women who take baths have more urinary tract infections. Sorry, it's just the facts. Loose-fitting cotton clothing. Wick the moisture away. Frequent voiding of the bladder. Don't hold it. I know when you travel, you're on an airplane, things like that. You know, there are times. But don't make it a practice. When you feel the need to go, go. And take your time, get it all out. Any retained urine increases your risk of infection. And you can have retained urine and not realize it. That is a problem sometimes, but take your time, let it go. A healthy, high-fiber, plant-based diet of the Mediterranean style. It matters. Your diet matters. Control the dysbiosis. Many people with UTI have had multiple antibiotics, and they have yeast and intestinal dysbiosis. And you know what? These germs, they go from the gut through the bloodstream or the lymphatic to the urinary tract. It's not just from the outside in. It goes through the system. So this is the unsung hero in managing urinary tract infections. Control the dysbiosis. Get the bowel flora set right. Things like oil of oregano, probiotics, black seed oil, olive leaf, curcumin, medicinal mushrooms, cordyceps. In our book, Foundations for Healing, we go to great length to help you understand how to correct the side effects of antibiotics. Because when we do that, we most often break the cycle of recurrent urinary tract infections. A little vitamin C every day, a good quality multiple vitamin and mineral to support the immune system, and if we're postmenopausal ladies, a little topical estrogen cream can work wonders. Now, let's go to our break, and when we return, let's talk about how do we take this Cranberry and D-Mannose. How much do we need to take? What are the instructions? We'll be right back.
Can you lower your risk of disease? The answer is yes. One way is by including fruit in your diet. Fruit contains valuable nutrients that can reduce the risk of heart disease, stroke, and even some cancers.
We've searched the world and found 4 fruits we believe are among the best. Noni from Polynesia, acai from the Amazon, and 2 new ones, goji and mangosteen.
These 4 juices each have amazing properties that make them great additions to your nutritional plan. If you're a diabetic or have chronic pain, these juices will help you feel better and have more energy. Plus, they help with digestion.
Now you can experience the health-promoting benefits of all 4 in one convenient package we call the Fruits of the World 4-pack. And remember, it's 50% off by the case. Order online at bioinnovations.net or call 888-442-2128 and let us assist you in making the right choices for better health. Ask about the AutoShip program for additional savings. That number's 888-442-2128.
I'm Dr. Richard Becker, and this is Your Health at a Glance. Are you sleepy during the day? Many Americans are in a sleep crisis. They aren't getting a good night's sleep, so they suffer from daytime sleepiness. The reason may surprise you. You may be deficient in vitamin D. According to recent research, vitamin D deficiency leads to poor sleep quality. If you aren't sleeping well at night, you are sleepy during the day. Vitamin D and the hormone melatonin are critical to our sleep cycles. Both are tied to sunlight. This is one of the many reasons why working night shift hours can be so hard on the body. So, if you're finding yourself nodding off during the day, before you turn to another cup of coffee, try some of the sunshine vitamin and see how vitamin D can help you get a good night's sleep. For Your Health at a Glance, I'm Dr. Richard Becker. Have you heard about the health-promoting power of medicinal mushrooms? These remarkable mushrooms include maitake, shiitake, reishi, and ABM. The medicinal mushrooms contain beta-glucans, compounds that promote healthy immune function while helping to coordinate multiple body systems.
BioInnovations brings you Dr. Becker's Bionutrients Mushroom Complex with maitake, shiitake, reishi, and ABM in one convenient product.
Our mushroom complex features the safest and most powerful medicinal mushrooms available, providing natural support for a variety of health conditions.
BioInnovations is the affordable source that you can trust for all your vitamin and supplement needs. So give us a call at 888-442-2128. That's 888-442-2128. Or order online at bioinnovations.net. Ask about the AutoShip program for additional savings. Your Health is brought to you by BioInnovations, trusted products for your health and well-being.
We're back, everyone. I just want to give you a quick reminder about that special today. This one's just amazing. We've taken the cranberry extract that you already know and love, the one that's standardized, really works, and we've added D-Mannose to it, so you really get that double whammy benefit. This one really works. Buy one bottle at the regular price, you get a second bottle free. Richard, let's talk about how is the best way to supplement with this amazing product.
Well, if you take 3 of these capsules, you will get 500 milligrams of standardized cranberry extract. It is the Pacran that has been studied by so many researchers and proven effective. And that amount, 500 milligrams of this standardized extract, equals about 1 ounce of fresh cranberries right off the vine. 1 ounce. Should you take all 3 at once? Should you spread them out? I think it would be best if you spread them out, especially early on in your treatment. 1 in the morning, 1 at lunch, 1 in the evening. That would be great. But 3 capsules gives you the 500 milligrams, which is a typical studied dose. We know it's effective. And it would also give you 1 gram of D-Mannose, the 3 capsules. Now remember, the D-Mannose can be metabolized as an energy source. It's what we call a reducing sugar. But it's only 1 gram. That's 2.5 calories. It's not a significant source of calories, which means that diabetics, you can use this, because diabetics, you are highly susceptible to recurrent urinary tract infections. And I'm not telling you anything new, am I? You already know about this. If you have to use a catheter on a regular basis, it's surprising how many people, this is not something that you open a conversation with in a social setting, but many people do this for medical reasons. They have no choice. And with that practice, it's common to introduce bacteria, and they have to constantly be aware of this. This would be an excellent way to help you prevent the next infection. So 3 capsules a day provide you with that amount, a studied amount. As you start this program, please, less coffee, less tea, and especially soda. More water, more water. Improve your hygiene. Make an effort here. Loose-fitting clothing, particularly cotton, or breathable. You know, our new fabrics are so much better than they used to be. Breathable clothing that wicks moisture away. Frequent voiding of the bladder. High-fiber, plant-based diet, low in sugar and starch, because the sugars and starch, they perpetuate the dysbiosis, which is the ultimate source of abnormal bacteria that are causing your infection. Treat the dysbiosis. Agents like oil of oregano, black seed oil, olive leaf, curcumin, these anti-yeast measures, boy, they make such a difference. Vitamin C, many people will take vitamin C with this. That's controversial. Not everybody agrees, but I've seen it help people. A gram of vitamin C 4 or 5 times a day. Quality nutrients make a difference in quality health, folks. Prevent the infections. Get away from the antibiotics wherever we can. Cranberry with D-Mannose. 3 capsules a day. Implement the other measures. We can break this cycle. Stick with it. It'll make a difference. We'll see you, folks. Thank you for joining us. Bye-bye.
Thanks, everyone. We'll see you tomorrow right here on Your Health. Bye-bye.
Hello, I am Luan Abram Rouse. With me today is my wife, Marie. We are part of the American Clergy Leadership Conference that I have the privilege of being the co-chairman for the United States of America. The American Clergy Leadership Conference is about restoring the family, rebuilding the community, renewing the nation and the world. We do this through the blessing of couples, the blessing of families, that we might be sincere to the Word of God that asks us to be fruitful, multiply, and replenish the earth. We're reaching out to you because we desire for every family in the world to be blessed. And America is the hope for the world. So come and be blessed through the American Clergy Leadership Conference, male and